Hi, this is Dr. Lewicki, and I'm going to talk. This voiceover is about the nursing process again, and this is step 2 and 3, which is the nursing diagnosis and plan. And we'll spend a lot of time in class talking about how to formulate a nursing diagnosis and how to create a plan. So there's different types of nursing diagnosis or types of diagnoses. One is the medical diagnosis, and that's not our job. That's the physician, the healthcare provider. It identifies the physical problem or diagnosis for treatment. The nursing diagnosis is common language used for the communication nurse to nurse, and it involves problems managed by nurses. So what is the difference? So just a couple of examples. So in the nursing diagnosis, I'm concerned about their breathing. The medical diagnosis is looking for a cause for that problem. I'm looking at making their breathing easier. A nursing diagnosis, I'm concerned about their pain. The medical diagnosis is looking for a cause for that problem. Hope that makes sense to you. So it's the nursing diagnosis is step 2 in the nursing process. It's based on your assessment data. It uses standardized terminology for nursing. That's not the medical diagnosis. And it can be pathophysiologic, treatment related, personal, environmental, or maturational. Collaborative problems also are part of the process, and they require medicine and nursing interventions. So all physiological complications are not collaborative problems. There are some that as a nurse, the things I can do as a nurse can help resolve that problem or prevent the onset of a complication. Collaboration helps us better manage the multiple factors that influence the health of individuals, families, and communities. And what this really means is that I may know that they need pain medication, and I could administer it if it's ordered, but I cannot order it. That takes collaboration. The healthcare provider needs to order it. I may know that they need oxygen, but the healthcare provider is the one that needs to order it. So one of the common tools that we use is called NANDAS. So they're the North American Nursing Diagnosis Association. It's actually now NANDA-I. I didn't write the I on my PowerPoint, and that ends international. There's 3 types. They're problem focused, there's risk, and there's health promotion. And the components of the nursing diagnosis, they're So again, problem focus, it describes a clinical judgment concerning an undesirable human response. So like I said earlier, pain, shortness of breath, there's all kinds of problems, thermoregulation, things like that. It has to have a defining characteristic. And it will say, and we'll spend time in class and we'll look in your care plan book and what the defining characteristics are. And this becomes the diagnostic label. That's where NANDA comes in. NANDA has created the defining characteristics and the diagnostic label. Then it has a related factor. It's related to an etiology or cause. That's one of the areas that students struggle with a lot, and they struggle with it for a lot of reasons. But it's because we really try to make it end up being a medical diagnosis. But just to give you an example, let's say the patient comes in short of breath. Let's say you already know they have a diagnosis of pneumonia. So I'm giving you a couple of hints. So you might say, because you hear them coughing and you can hear abnormal breath sounds, so you determine that they have ineffective airway clearance. That's an approved NANDA label. Ineffective airway clearance. Well, what's it related to? What's the cause? Well, you want to immediately make that pneumonia because you know they have pneumonia. And you know what? That really is the cause. But NANDA wants us to actually look at it a little bit different. They want us to say infection in the lungs or inflamed tissue in the lungs as the related to factor, because that is what the actual etiology is. Then you want evidence to support the diagnosis. So that's where the symptoms fall in. So you would say, and I will work this through with you and we'll spend more time in class on it, but you will say that ineffective airway clearance related to inflammation of the airways, as evidenced by cough, wheezes, um, thick green secretions, whatever you see as the symptom. And that is your full 3-part nursing diagnoses. Risk diagnoses are the vulnerability of an individual, family, group, or community of health conditions, life processes. So that means they don't have defining characteristics, but you're worried that they're at risk for something. They're at risk for falls. They're at risk for injury. They're at risk for infection because they had surgery. That's what the risk is. And so that's what you would say, risk for falls. And then health promotion, clinical judgment concerning motivation and desire to increase well-being, and it does have defining characteristics. So then you're going to so our first step was assessment. So you've gathered all this data. And now what you want to do is you want to cluster that data. You're going to analyze and organize the data in meaningful and usable clusters. You're going to cues, signs, symptoms. It can be objective or subjective data, intentional assessment, which is your physical exam and interview, or unintentional assessment, which is the cues that you've noticed. You're going to cluster that together. All data doesn't cluster in, or most data doesn't cluster into one pool of data. And so we will work on that in class. But you're going to use the clusters of data to find a diagnostic label. So let's go back to our patient with pneumonia. Our patient with pneumonia probably also has a fever. Maybe they have an elevated heart rate. Maybe they have, like I said, the ineffective airway clearance, things like that. So you're going to take that data, those assessment findings, and you're going to cluster those into different diagnostic labels and determine the related factor and describe the evidence. One diagnostic label does not have to cover all the areas of concern. And in fact, many patients will have several plans of care based on their presenting symptoms or the areas of concern. So in practice, a lot of times you'll see concept mapping. There's cultural relevance in diagnostics, so you always want to consider your patient's cultural diversity, including ethnicity, values, beliefs, languages, and health practices. And this is figure 17.5 from the textbook. There are sources of diagnostic error when you are, as the nurse, are looking at the information. You could have made an error in your data collection. You could make an error in how you cluster the data, analysis, interpretation of data, or maybe it's the wrong diagnostic statement. And so there are guidelines to reduce diagnostic errors as well. Documentation and informatics. So a lot of times now, you'll hear nurses say when you're in clinical, we don't ever do care plans anymore. It's really important as the student for you to do care plans. What they do now is it's an interdisciplinary plan of care, and it's done in electronic health record. They use standard familiar terminology and an EHR that help provide nurses greater ease in their selection of nursing diagnoses and interventions in the planning of patient care. Once you identify a patient's nursing diagnosis, you enter that in the EHR of the agency. And maybe it's not NANDA formatted. Maybe it's just ineffective breathing or poor airway clearance. It might not be in that NANDA, approved NANDA. The agency information system will dictate how the diagnosis is disseminated throughout the record. And then you're going to list diagnoses chronologically rather than a priority method. Diagnoses direct the planning process and the selection of nursing interventions to achieve desired outcomes for patients. So back to the couple of things that we've talked about. Excuse me. Ineffective airway clearance and pain. Let's just talk about those two things. They help decide what I'm going to do as a nurse when I get into that implementation phase. So, what am I going to do for ineffective airway? The steps that I'm going to do as a nurse are going to be different, maybe similar to how I'm going to manage their pain. The care plan is a roadmap for delivering nursing care and demonstrates your accountability for that patient care. And by making accurate nursing diagnosis, your subsequent care plan communicates the patient's healthcare responses to the healthcare team. Now, the next phase in the process is the planning phase, and that's where we do our goal setting. The plan is the outcomes and goals for the patient to strive for to improve the identified problem. It's done in collaboration with the patient and family, requires critical thinking and deliberate decision making, and it should be individualized to the patient. You're going to establish your priorities. So priority setting is the ordering of the nursing diagnoses or patient problems based on urgency, and we'll talk about that in just a minute. This can change throughout your shift as patient conditions change. And when you first start at nursing school, you're going to take care of one patient, but you'll see that the nurse has 5 or 6 that he or she is responsible for. So your prioritization for patient A may be your highest priority when you start your shift, but things improve there, and patient D needs bumps up in the priority list because their condition changes. They're classified as high, intermediate, or low. And one of the ways that we prioritize is through Maslow's hierarchy of needs. That helps us. If somebody's unsafe or can't breathe, then that they become our higher priority. So I'm going to refer you to this. I'm not going to read this to you, but it's a model for prioritization. And one of the key things in here is experience. And you at this moment don't have experience. Every patient interaction you have throughout nursing school and throughout your nursing career helps to build your experience. Excuse me. So goals are broad statements that describe a desired change in patient's condition, perceptions, or behavior. Expected outcome is a measurable change that must be achieved to reach a goal. We're going to talk about SMART goals in just a minute. But goals and expected outcomes should be patient-centered and should focus on the as evidenced by portion of the nursing diagnosis. My outcome is going to focus on the broader picture. My goal is going to focus on my evidence. Nursing sensitive patient outcomes. They're measurable patient, family, or community state, behavior, perception influenced by nursing interventions. So you'll see that the floors keep track of when was the last fall, pressure ulcers, infections, things like that. Writing goals and outcomes. They should be SMART goals, specific or singular, just trying to fix one behavior, measurable, attainable, realistic, and timed. And we struggle as sometimes with attainable, realistic, and timed will be short-term or long-term. And so short-term, by the end of my shift, within 4 hours. Long-term is sometimes weeks or months. Then we're going to select interventions, and we'll talk more about this in the next PowerPoint, but they're individualized for the patient. And you want to consider their desired patient outcomes, the characteristics of the nursing diagnosis, research-based knowledge for the intervention, feasibility for doing the intervention, acceptability to the patient, and your own competency in performing the intervention. When you start to write nursing care plans, we're going to always ask you for your rationale for why did you choose that intervention. Their nursing interventions are classified in different domains, in different classes, and different interventions. There are systems for planning care, including computerized plans of care, standardized care plans. There's software programs, and I said earlier that in the hospitals now we see the interdisciplinary plan of care. One of the ways we use the nursing care plan is in our handoff reporting. And a handoff reporting, and we'll talk more about this in communication, but it transfers care from one healthcare provider to another. It's usually during change of shift or transfer to another unit. One of the ways we do that is using an SBAR, and we'll talk about that SBAR in communication. Provides accurate, up-to-date, and pertinent information to the next nurse. It's critical time to ensure continuity of care and prevent errors or delays. And written care plans organize the information to be used in handoff. Student care plans, again, the nurses at the hospital are going to say, we don't ever have to do care plans anymore. You never see that. You do actually see. You may not see it written the way that you write it as a student, but it is still part of what you do. It helps, but they help you to learn problem-solving techniques. It puts a process in place to help build your thinking muscles, your critical thinking muscles. It employs the nursing process. They improve skills of written communication, provide organizational skills, and applies learned knowledge. And one of the ways we do that is concept maps. And then another piece of the planning is consulting others. So patient care in this decade really involves a healthcare team. You as the nurse or even the physician are not able to necessarily provide for all the complicated needs of patients in this century. Be aware of strengths, your own strengths, and your own scope of practice. And you may consult with other professionals to achieve a goal, or you may consult with a nurse that has more experiences than you do. All right, and we will work on a lot of this in class, and that is the end of this presentation.